But what exactly causes Alzheimer's disease? Well, there are many factors that contribute to Alzheimer's disease, including old age, genetics, and one's lifestyle choices. But the two most prominent theories as to why people have Alzheimer's disease are within the brain. The first theory involves how the brain communicates with itself. In the brain of someone with Alzheimer's disease, there are a lower number of certain neurotransmitters which allows for decreased communication between nerve cells. The second theory, and one of the most prominent theories today, is the abnormal deposit of protein in the brain. These are called plaques and tangles. They are made up of two key proteins, called amyloid and tau. Amyloid and tau proteins are present in healthy brains, but in Alzheimer's disease, they are irregular. In the brain of a person with Alzheimer's disease, amyloid forms plaques outside cells and tau forms tangles inside. The plaques and tangles damage the nerve cells, which cause them to die. When many cells die, the brain starts to shrink. The hippocampus is usually one of the first regions of the brain to be affected. The hippocampus has a major role in forming memories, so a person with Alzheimer's disease would often have trouble forming new memories and even struggle to remember what they just did.
Alzheimer's disease is a form of dementia, a syndrome that impairs memory, thinking, and social skills, leading to a decline in day-to-day functioning. Dementia is not a distinct sickness, but rather a collection of symptoms resulting from various underlying diseases. In fact, 60 to 80% of dementia cases are caused by Alzheimer's disease. The progression of Alzheimer's disease is gradual, starting slowly and worsening over time. Earlier symptoms often include memory loss, difficulties in speech, poor judgment, and deficits in problem solving that can worsen over time. Currently, there is no conclusive test to diagnose Alzheimer's disease in a living person. Diagnosis is typically made through a comprehensive medical evaluation, which considers the patient's medical history, neurological exams, cognitive testing, and the exclusion of other potential causes for the symptoms. Researchers are exploring advanced brain imaging techniques and biomarker tests to aid in early diagnosis and disease monitoring.
Now I'm going to introduce you to Lecanemab, a groundbreaking medication developed by the esteemed Japanese pharmaceutical company SI. Lecanemab is an anti-beta amyloid monoclonal antibody that holds immense promise in the fight against Alzheimer's. Lecanemab is designed to target and neutralize harmful substances called A-beta peptides, which are responsible for the formation of amyloid plaques in the brains of people with Alzheimer's. By binding to and removing these toxic A-beta aggregates, Lecanemab aims to slow down the progression of the disease. This drug is intended for individuals in the early stages of Alzheimer's, particularly those with mild cognitive impairment or mild dementia, and those who have confirmed A-beta pathology. It is given through a simple intravenous infusion. To determine its effectiveness, Lecanemab underwent rigorous testing in a phase 3 clinical trial, and it suggests that Lecanemab slowed down the decline in cognitive abilities. Lecanemab represents a significant step forward in Alzheimer's research, bringing us closer to more effective treatments and potentially changing the course of this devastating disease. In summary, Lecanemab's ability to target and remove harmful A-beta aggregates and its potential to slow down the disease progression are significant advancements in Alzheimer's treatment.
Well then, why should you choose lecanemab when treating Alzheimer's? There are two types of drugs in treating Alzheimer's. One is cholinesterase inhibitors, and another is immunotherapies. And lecanemab belongs to the latter. While cholinesterase inhibitors like galantamine and rivastigmine work by binding to the enzyme cholinesterase to control cognitive and behavioral symptoms, immunotherapies like lecanemab target the protein beta amyloid to help reduce amyloid plaques. By targeting and reducing these plaques, lecanemab aims to slow down the advancement of disease and potentially improve cognitive functions in affected individuals. In similar terms, lecanemab aims to solve the problem of Alzheimer's at its very roots, whereas other drugs only target its symptoms. This is why, as a doctor, I would recommend lecanemab to you. Better to act early than to regret later, so come and get your lecanemab right now.
In a world where memories unravel, hope emerges. Lecanemab embarks on a heroic quest against Alzheimer's. It vanquishes amyloid plaques, restoring cherished moments and slowing the disease's march. Choose lecanemab, the key to reclaim, unlocking memories, breaking Alzheimer's chain.